Welcome to Impact Signals, social impact at the scale of AI. I'm Charlie.
And I'm Sarah.
It's Monday, March 16th, episode 32. And today we're tracking how institutions are building the governance rails that humanitarian AI actually needs before deployment outruns accountability. We start in India, where a policy move that may look like bureaucratic paper pushing is actually one of the most practically significant governance launches in global health AI this year. At the India AI Impact Summit on February 17th, the Union Health Minister launched two paired frameworks, SAHI and BODH.
Let's unpack those. SAHI, Secure AI for Health Initiative, is the governance layer. It's a national framework setting out the ethical, transparency, and evidence requirements for deploying AI in India's public health system. But the part practitioners should pay attention to is BODH, the benchmarking open data platform in health AI.
And BODH is the instrument. Developed with IIT Kanpur and India's National Health Authority, it uses federated learning to let any health AI developer, Indian or international, validate their diagnostic tools against anonymized, real-world Indian patient data without ever touching the underlying datasets. The privacy architecture is built in.
ICTworks noted something worth flagging for our listeners. LMIC national AI strategies almost never launch with a complementary operational instrument. You get the policy document, and then nothing happens. SAHI and BODH are designed as a pair, the governance compass and the validation engine, simultaneously.
This is launched under the Ayushman Bharat digital mission, and it arrived the same week the summit drew $67.5 billion in AI infrastructure commitments from major cloud providers, Google pledging $15 billion over 5 years for a Visakhapatnam hub, Microsoft $17.5 billion, and major cloud and commerce investment through 2030.
For practitioners building or evaluating health AI tools for LMICs, BODH is now a live benchmark infrastructure. That changes the calculus for what it means to validate a diagnostic tool before deploying it in a resource-constrained setting.
Second story today, and this one bridges preparedness and recovery in a way the sector has been trying to figure out for years. GiveDirectly and Google are running what may become the sector's most consequential randomized controlled trial in anticipatory action.
Here's the setup. Google's Flood Hub platform, which already covers riverine flood forecasting for over 2 billion people in 150 countries, has a publicly accessible flood forecasting API. GiveDirectly has wired that API into a payment trigger. When the AI model forecasts that more than half of a village in northern Bangladesh is at risk of flooding, cash transfers go out to families before the water arrives.
In 2026, GiveDirectly is running this as a structured RCT covering more than 100,000 families in Gaibandha and surrounding districts. 4 groups: cash before floods, cash after floods, warnings only, and no intervention, funded in part by Google.org. The goal is to generate the most rigorous head-to-head evidence base we've ever had on anticipatory versus reactive cash transfer.
They've already run this in 2 prior contexts. A Nigeria pilot in Kogi State in August 2024 reached 4,463 people with pre-flood cash. Families reported using it to protect livestock, reinforce structures, buy essentials before displacement forced those decisions away from them. The agency component is the key finding from early pilots.
What makes this technically replicable is that Google's Flood API is publicly accessible. Any organization with the technical capacity to build a payment workflow can, in principle, connect it to the same forecast data. This isn't a proprietary black box. It's open forecasting infrastructure with a proven trigger mechanism.
The RCT results, expected in late 2026, will be the evidence standard the sector has been waiting on. For any organization currently doing post-disaster cash, this is the study that will determine whether the entire model needs to shift upstream.
Third story, a partnership announced March 12th that's worth tracking for what it signals about how crisis analysis operations are starting to change. Cloudera announced a collaboration with Mercy Corps to deploy Agentic AI workflow architecture for Mercy Corps' global crisis analysis teams.
These are the teams that synthesize intelligence on conflict dynamics, food insecurity, displacement trends, economic shocks, across multiple operating contexts simultaneously. The system continuously processes fragmented data, news outlets, websites, humanitarian information platforms. It layers in multilingual support and conversational refinement, so analysts can probe and refine outputs rather than accepting static summaries.
The design principle Cloudera stated explicitly, rather than attempting to automate judgment, the solution was designed to accelerate it. That framing matters. We've seen sector debate about AI replacing expert analysts. This architecture positions AI as the compression layer, not the decision layer.
For practitioners running multi-context monitoring operations, this is a signal about where agentic AI is actually being deployed for operational intelligence at scale. The synthesis cycle compresses from days to hours. The analyst stays accountable for the output.
Story 4 is structural, and practitioners need to hear this whether or not it feels immediately operational. We have two converging datasets that define the sector's most critical vulnerability right now.
First, the Humanitarian Leadership Academy ran a pulse survey following their study of 2,539 humanitarian workers across 144 countries. The headline finding? 93% of humanitarian workers use AI tools. Only 8% work in organizations with fully integrated AI strategies.
That gap, 93 to 8, is where the risk lives. It manifests in 5 failure modes: an implementation gap between individual adoption and organizational capability, a skills paradox where AI competence is building but isn't being institutionalized, fragmented training despite 73% of workers identifying it as a priority, a governance vacuum with no accountability structures, and tool dependency on commercial platforms built for other sectors.
And then the second dataset, an archive preprint published this morning, presented at the International Association for Safe and Ethical AI conference, titled The Coordination Gap in Frontier AI Safety Policies. The central argument is that global AI governance has been almost entirely focused on prevention, internal deployment gates, capability evaluations, and almost entirely absent on coordinated response.
The paper argues for what they call coordination primitives: cross-institutional early warning systems, predefined response procedures, shared escalation networks, and practically, a public registry requiring AI developers, cloud providers, and government agencies to file standardized response plans, so when something goes wrong with the deployed system, the sector isn't improvising from scratch.
For humanitarian organizations, the EU AI Act's high-risk category enforcement deadline is now 5 months out. Organizations that have been deploying without governance frameworks are going to face both legal and operational exposure. The 8% figure is the benchmark to beat.
Fifth story today addresses the recovery gap we track on this show. A World Bank feature published today on ReliefWeb documents Yemen's Integrated Urban Services Emergency Project, YUISEP, which ran from 2017 through 2020 and is continuing into a second phase.
The need context first. 19.5 million Yemenis require humanitarian aid, including 15 million women and children. 2/3 of the population lacks access to safe water and sanitation. The conflict has destroyed urban infrastructure across multiple cities.
YUISEP's first phase deployed $150 million to restore urban services. The verified outcomes: 3 million beneficiaries regained access to basic urban services, 1.5 million person-days of work generated, 240 kilometers of roads restored, 1.2 million people gained access to water, sanitation, and hygiene services.
The design principle that drove those numbers is worth naming: a deliberately balanced regional approach, ensuring equitable distribution across Yemen's politically and geographically diverse regions. In a context where conflict lines shape who gets services, the decision to resist political geography in service delivery is itself a governance choice.
For recovery practitioners working in active conflict environments, YUISEP is a documented evidence base for what urban recovery infrastructure looks like when you run it with equity as a design constraint, not an afterthought.
And finally today, a monitoring signal from East Africa that practitioners with Horn of Africa programming should be tracking. UNCHR issued a protection and solutions monitoring flash alert this week. Severe drought in Wajid district, southwest state of Somalia, has triggered displacement of over 4,500 civilians. Displacement is ongoing.
The Somalia context you need for this: 6.5 million people are already food insecure in the country. 180,000 or more were displaced from prior crises. The humanitarian response plan for Somalia is funded at only 13.4% of what it needs.
Drought-triggered displacement from southwest state is one of the early indicators that precedes broader food security crises in the Horn. For organizations with regional operations, the Wajid displacement is a trigger to review Q2 pre-positioning plans, not just respond to what's already happened.
Before we close, your events calendar for the next 30 days. NVIDIA GTC kicks off tomorrow through Friday in San Jose with an AI for Good track featuring humanitarian AI deployments. Wednesday and Thursday, Disasters Expo USA runs in Anaheim, the Emergency Management Technology Industry Show. Next week, March 24 through 26, the AAAI Spring Symposium on AI and Humanitarian Assistance and Disaster Response is at Stanford, the Academic to Practitioner Bridge Conference. March 28 through 30, RightsCon in Nairobi covers digital rights and AI governance with direct humanitarian application.
April 1st through 3rd, the IAAP Global Privacy Summit in Washington, D.C. covers AI governance and humanitarian data protection, directly relevant given the governance gap we just covered. April 8th through 10, Action on Disaster Relief 2026, also in Washington, D.C., practitioner heavy. And April 26th through May 1, ACM CHI 2026 in Yokohama covers crisis informatics and accessibility AI.
That's Impact Signals for Monday, March 16th. If this briefing is useful, subscribe wherever you get your podcasts. Check us out at impactsignals.ai and share it with someone working in the field.
Stay ready.